New York Governor Andrew Cuomo making headlines today for these comments on the coronavirus.
Governors don't do global pandemics, right? But there's a whole international, national health community would do that. Where are all the experts? Where was the New York Times? Where was the Wall Street Journal? Where was all the bugle blowers who should say, be careful, there's a virus in China that may be in the United States? That was November, December. We're sitting here, January, February, still debating how serious this is. And again, it's not a state responsibility.
NBC News investigations correspondent Tom Winter joins me now. And Tom, at the end of January, the WHO called this virus a global health emergency. But in March, Governor Cuomo still sounded optimistic. Here's what he said then.
And excuse our arrogance as New Yorkers. I speak for the mayor also on this one. We think we have the best healthcare system on the planet right here in New York. Amen. So when you're saying what happened in other countries versus what happened here, we don't even think it's going to be as bad as it was in other countries.
We know Cuomo's gotten praise for his leadership during this pandemic, but how has he responded to criticism that he may not have acted early enough?
Yeah, well, he's not responding to it very well, Allison. And he's doing something that most politicians typically do when they get questions from the press, who, by the way, we're asking this on behalf of everybody that's watching us. So our job is to ask the questions that the people that are sitting at home trying to educate their kids, trying to work from home, or maybe are unemployed because of all this, would like to ask the governor himself. And politicians, we see it from the White House to the mayor's offices across the country. When they get these type of questions, they like to throw it back on the press. Here's an article. This article comes from January 17th. It's on a website called NBC News .com. It's from the Associated Press.
I've heard of
it. You might have heard of it. What does it talk about? It talks about a second person has died from a new coronavirus. It lists that the person exhibited abnormal renal function, which is, tied to the kidneys, which we know is an issue. Severe impairment in multiple organs. That might be something that you and I have talked about, half a dozen times. It talks about inflammation of the heart muscle and other pressing ailments. I don't know, Allison, I seem to think that you and I have talked probably at least a dozen times over the past 2-3 weeks about cardiac call issues that we're seeing here in the New York City area. So I'm not really sure what the governor is speaking about. I know that other publications put out the same information, and other organizations were on top of this. It'd been a focus of our sister network, the business network, CNBC, as well as MSNBC, and of course you and here at News Now. So I'm not really sure what the governor is focusing on here and somehow blaming the press. Now, I'll say this. There is no doubt that the information that the U.S. government and local governments received from the WHO was probably delayed. It was probably did not raise the level of seriousness and kind of the extreme results that this virus could give us that we're now experiencing soon enough. There's no question about it. There's no question that China was probably not as transparent as they needed to be based on the reporting of my colleagues and other publications. And there's no doubt that the governor recognized at some point that this was going to be very bad and that he acted on it, and he has provided leadership at different points. And his leadership is certainly better than the mayor, that while the governor was talking and closing down Broadway, while the governor was closing down the St. Patrick's Day parade, the mayor of New York City, Bill de Blasio, was still talking about keeping those things open. So, look, he's been better than other politicians, but this idea that somehow the press didn't do its job is laughable on its face. And on top of that, government agencies in New York were already doing their job, too. The FDNY had already instituted new 911 call procedures at the end of January. So maybe next time he should talk to the experts on the city's front lines.
Tom Winter fired up, and with good reason. And I just have to say, because we have talked about this at NBC News Now so many times, we have a production assistant, Jordan Winter, who mentioned in a news meeting back in 2019 which seems like a million years ago, but towards the end of the year, hey guys, there is this virus in China that seems really unusual and isn't getting a lot of attention. We should cover it. We should mention it in our headlines or in the news. And we did. And I keep thinking back to that day that Jordan was paying attention to something. And all we keep hearing about is that nobody knew. But one of our production assistants was reading about it. I mean, the news was paying attention. We knew something was
I got my first briefing.
So thank you for pointing to that.
Well, I went back and I checked my call logs. I got my first briefing from somebody in the New York City government and the fire department on January 3rd. At that point, they had already started to gather information. It was based on public resources. So, you know what? I don't want to hear it. And that was in the middle of an impeachment inquiry, an impeachment vote in the House and in a investigation in the Senate. So we were on top of it then. And look, a failure of imagination by everybody on the planet, probably. Nobody had been really alive to see this. I mean, the last major global pandemic was 1918, and there's a lot of lessons that we'll learn from this, and hindsight's 2020. And we in the press will learn our lessons from this as well. But to say that the bugle blowers weren't blowing is just foolish.
No, I heard a whole lot of bugles right there with you, Tom. All right, a couple more questions for you. Let's talk about the governor's plan to reopen New York. Today, he did talk about that, and he outlined two key data points that he is watching when making that decision. What are they?
Yeah, so a couple of key things that they're looking at, and we're seeing some good progress here. The first off is the level of new people that are coming into the hospital system. So we got some updated numbers just in New York City alone this afternoon. And one of the key things is how many new people are coming in. We're at a point now we're going to see probably less either today or tomorrow. It's possible that we saw it late yesterday. Less than 100 people come into hospitals, new patients with coronavirus. That's down a lot. Just a week ago, it was over 200. It had been much higher before. So he's focused on that hospital capacity. And then on top of that, it's the infection rate. So are we starting to see the amount of new cases decline? And are we starting to see that number decline in the face of more testing? That's another key parameter. So if we all of a sudden blow out the testing numbers and really jump up there, do we have lower rates of people that are being infected with it? Both of those are key metrics. Can we handle any more infections? That's important, Allison.
All right, Tom Winter, always great to have you with us, especially today, though, when it seemed the press needed a little bit of defending. Thank you so much.
Thanks.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.